Thank you for subscribing to our channel. We sincerely appreciate all our subscribers for the positive response to our previous video. This video is a comprehensive exam-oriented listening test specifically designed to support students preparing for the OET exam tomorrow. Our team extends our best wishes to all students taking the test. Thank you.
Listening test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now look at the notes for extract 1.
You hear a patient called Michael Davis attending a follow-up consultation with a podiatrist regarding plantar fasciitis. You now have 30 seconds to look at the notes.
Hi, Michael. How has your foot been since your last visit?
Unfortunately, it's been getting worse. I was diagnosed with plantar fasciitis about 2 years ago, and lately the pain in my right foot has really intensified. I've noticed it, especially after I've been on my feet for a long time, like after taking a long walk. The discomfort is much more pronounced than it used to be, and it's starting to affect my daily activities more and more.
And how is this affecting your work?
I'm a delivery driver, which means I'm constantly on my feet, going in and out of the van and carrying packages. The pain has started to really impact my job. Simple tasks, like going up and down stairs, have become increasingly difficult and painful. I've noticed that it's not just discomfort anymore, it's something that I actively dread because of the pain. As a result, I've had to start avoiding long walks altogether, which used to be a normal part of my routine. It's frustrating because it feels like the pain is limiting what I can do, both at work and in my personal life.
What changes have you made to manage the pain?
I've had to give up football, which was something I really enjoyed and looked forward to every week. The pain has made it impossible to continue playing. Now, instead of walking, I've switched to using a bike for short trips, which has been a big adjustment for me. I've also tried to alleviate the pain by wearing orthopedic insoles, but unfortunately, they haven't provided much relief. It's been frustrating because I was hoping they would make a significant difference, but the discomfort in my foot persists.
What medications are you currently taking?
I've been taking anti-inflammatory drugs to help manage the pain, which provides some relief, but the discomfort is still quite noticeable, especially after being on my feet for a while. Just recently, I've begun physical therapy sessions in an effort to address the underlying issues causing the pain. However, since it's still early days, I haven't yet noticed a significant difference or improvement. I'm hopeful that with time, the therapy will start to show positive results, but for now, it's a waiting game to see how effective it will be in the long run.
You hear an occupational therapist talking to a patient called Liza Hernandez. She has been diagnosed with Raynaud's phenomenon.
Hi, Lisa. How are things going with your condition?
It's been quite challenging. I was diagnosed with Raynaud's phenomenon about 6 months ago, and since then, the discomfort in my hands has significantly worsened, particularly when I'm exposed to cold environments. The pain can be quite intense, making it difficult to perform even simple tasks that involve my hands. Additionally, I've noticed that my hands have become much stiffer than they used to be. This stiffness often persists even after I've warmed up, and it's made everyday activities like typing or gripping objects increasingly difficult. The condition has had a noticeable impact on my quality of life, especially during the colder months when the symptoms are more pronounced.
How is it impacting your work?
I'm a professional typist, so the impact of Raynaud's on my work has been quite significant. Typing, which is something I used to do effortlessly for hours on end, has now become a real challenge. The pain in my hands makes it difficult to maintain my usual pace, and I found that I need to take more frequent breaks just to give my hands some relief. These breaks are necessary because the discomfort becomes overwhelming after just a short period of continuous typing. Additionally, I've noticed that the cold makes my symptoms even worse, so I've had to adjust my work environment to try to keep my hands warm. Despite these adjustments, the stiffness and pain still make it hard to get through a full day of work, and it's affecting my productivity significantly.
Have you made any changes to help manage the symptoms?
I usually stay away from outdoor activities when it's cold because it really aggravates my symptoms. To cope, I use hand warmers quite often, especially when I have to be outside for any reason. I also decided to try taking vitamin supplements, hoping they would help with my circulation, but unfortunately, I haven't noticed much of a difference.
I see. Managing symptoms in cold weather can be challenging. Could you tell me more about the treatment you're currently following?
Sure. Initially, I started with a medicated cream that my doctor prescribed. It was meant to reduce the discomfort in my hands, but I didn't find it very effective. After discussing it further, we decided to switch to using patches. These seem to be a bit more effective for me, as they provide more consistent relief throughout the day, although it's still not perfect.
Lisa, we're here to support you in finding the best way to manage your symptoms. Let's set up an appointment for you with the physical therapist, and we'll schedule a follow-up with me in a few weeks to check on your progress.
Thank you so much, Doctor.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen.
All right, team, before we proceed with our morning rounds, I need to take a moment to emphasize a crucial aspect of our daily routine: hand hygiene. This has become even more important given that we've seen a slight uptick in hospital-acquired infections over the past month. This increase, while modest, highlights the need for us to be vigilant and adhere strictly to our infection control protocols. First and foremost, please ensure that you are consistently using alcohol-based hand sanitizer before and after every instance of patient contact. This practice is vital in reducing the transmission of pathogens between patients and healthcare providers. The hand sanitizer should be applied thoroughly, covering all surfaces of the hands and allowing it to dry completely before proceeding with any other tasks. Additionally, do not underestimate the importance of wearing gloves when indicated. Gloves should be worn when you anticipate coming into contact with bodily fluids, handling contaminated materials, or performing any procedures that require them. Remember that gloves are not a substitute for hand hygiene. They should be used in conjunction with proper hand washing or sanitizing practices.
Mr. Jenkins, I've reviewed your recent concerns regarding the blood pressure medication you're currently taking. I understand that you've been experiencing dizziness, particularly after taking the medication in the mornings. This is actually a recognized side effect of this type of medication, as it can sometimes cause a drop in blood pressure when standing up or moving too quickly. To address this issue, we have a couple of options. One approach might be to adjust the timing of your medication. For instance, if taking it in the morning is problematic, we could consider shifting the dosage to the evening to see if that alleviates the dizziness. Another possibility is to adjust the dosage itself. Sometimes, a lower dose can be just as effective without causing as many side effects. I will consult with Dr. Patel, who is our specialist in managing these types of prescriptions, to review your current medication regimen. Dr. Patel will assess whether any modifications are necessary and if there are alternative medications that might be better suited to your needs.
Carter experienced a particularly restless night due to significant discomfort in her lower back. Given the intensity of the pain, we promptly adjusted her pain management plan. To address her acute pain, an additional dose of analgesic was administered at approximately 2 n. This intervention appeared to provide some relief, as she reported a decrease in pain following the administration. Throughout the night, her vital signs, such as heart rate, blood pressure, and oxygen levels, remained within stable ranges, which is reassuring. However, given the fluctuating nature of her pain and the need to fine-tune her management plan, it is crucial that she is closely monitored throughout the morning. This will allow us to determine if further adjustments to her pain management are necessary and to ensure that she remains comfortable and stable. Additionally, Ms. Carter is scheduled to undergo MRI later today. This imaging study will provide us with more detailed information about the condition of her lower back and help us better understand the underlying causes of her pain. The results of the MRI will be critical in guiding any subsequent changes to her treatment plan and in addressing her pain more effectively. In summary, while the additional dose of analgesic has provided some improvement, continued observation is essential to ensure her pain is managed adequately. We will closely monitor her condition this morning and review the MRI results to make any necessary adjustments to her care plan. If there are any further concerns or changes in her condition, we will address them promptly to ensure Ms. Carter's well-being.
I want to update you on the patient in room 204, who is under isolation precautions due to a suspected case of tuberculosis, PAP. We are waiting for sputum test results later today to confirm the diagnosis. Until we have confirmation, please continue using N95 respirator masks and other airborne precautions to protect yourself and others. Ensure that only essential personnel enter the room to limit exposure. Maintain strict hygiene practices, including hand washing and the use of personal protective equipment. If you notice any changes in the patient's condition, report them immediately. Thank you for your adherence to these protocols.
Stevens, I'm pleased to report that your progress following the knee replacement surgery has been very positive. Today, our focus will be on strengthening exercises, which are essential for your recovery. These exercises are designed to enhance the strength and flexibility of your knee, which will help you regain mobility and improve your overall function. It's important to perform these exercises diligently at home to maximize your recovery. Aim to do them twice daily, ideally in the morning and evening. Consistency is key to achieving the best results. If you encounter any sharp or unusual pain during the exercises, it's crucial to stop immediately and inform me at your next appointment. Persistent pain could indicate a complication that we need to address. In addition to the exercises, applying ice regularly can be very effective in managing swelling and discomfort. I recommend using an ice pack for 15-20 minutes several times a day, especially after performing the exercises or if you notice increased swelling. We'll continue to monitor your progress and adjust the rehabilitation plan as needed. Remember, your commitment to the exercises and self-care is vital for a successful recovery. If you have any questions or concerns between now and your next visit, don't hesitate to reach out. Morning, everyone. I wanted to update you on Mr. Thompson's current status. Following the results of his blood culture, which came back yesterday, we made an adjustment to his antibiotic regimen. He has been switched to a more targeted antibiotic therapy, specifically selected to address the pathogen identified in his culture. Since the change in his medication, we have been closely monitoring Mr. Thompson for any potential adverse reactions. So far, he has not shown any significant side effects, but we will continue to observe him carefully. His body temperature has been stable since we began the new treatment, which is a positive sign. Additionally, his white blood cell ADB count is gradually moving back towards normal, indicating that the targeted therapy is likely having the desired effect on his infection. However, we need to be vigilant about monitoring his renal function because the new antibiotic has nephrotoxic properties. This means there is a risk of kidney damage, so it is crucial to keep a close eye on his renal health. We have scheduled laboratory tests for 2 p.m. today to assess his kidney function and ensure there are no signs of adverse effects from the medication. Please make sure to check his vitals regularly and report any unusual symptoms immediately. If you have any questions or need further information, let me know. Thank you.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear 2 different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1.
Afternoon, everyone. I'm Dr. Emily White, and I specialize in endocrinology with a particular focus on managing diabetes. Today, I'd like to discuss some of the challenges we face in diagnosing and managing diabetes, particularly in adolescents. This age group can present unique difficulties as the symptoms of diabetes often overlap with those of other common illnesses, like the flu or even mononucleosis. For instance, fatigue, increased thirst, and frequent urination, classic signs of diabetes, can easily be mistaken for symptoms of viral infections, leading to delays in diagnosis. This delay can unfortunately result in complications that could have been avoided with earlier intervention. One prevalent misconception that I encounter frequently is the belief that diabetes, particularly type 2, can be fully managed solely through dietary changes. While it's true that diet plays an essential role in managing diabetes, we must recognize that it is a chronic condition that requires a multifaceted approach. Diet alone is often not enough, especially as the disease progresses. Most patients will require medications or insulin therapy to maintain proper blood glucose levels and prevent complications. Lifestyle changes are undeniably important. Regular physical activity, along with a well-balanced diet, can significantly improve glycemic control and overall health. However, These lifestyle modifications should be viewed as complementary to, not a replacement for, medical treatments. Unfortunately, adherence to these lifestyle recommendations can be challenging for many patients, particularly adolescents who may struggle with the dietary restrictions or the need to exercise regularly. Non-adherence can lead to poor glycemic control, which in turn increases the risk of long-term complications, such as cardiovascular disease, neuropathy, and retinopathy. Let me share a case that highlights these points. I recently treated a young patient named Tom, a 16-year-old diagnosed with type 1 diabetes. When Tom was first diagnosed, he and his family were understandably overwhelmed. They initially believed that by simply cutting out sugary foods, they could manage the condition. However, Tom soon began experiencing episodes of hypoglycemia, and we had to initiate insulin therapy. Through continuous education and support, Tom and his family began to understand the importance of a balanced approach. Tom now follows a tailored diet, exercises regularly, and adheres to his insulin regimen. As a result, he has achieved much better control of his blood glucose levels, and his quality of life has improved significantly. In conclusion, managing diabetes, especially in younger populations, requires a comprehensive approach. It's not just about treating the condition with medication. It's about educating patients and their families, creating personalized care plans that incorporate lifestyle changes, and ensuring that everyone has access to the necessary treatments. Only by addressing all these aspects can we hope to improve outcomes and help our patients lead healthier, more fulfilling lives.
Everyone. I'm Dr. Michael Lee, a cardiologist with a particular focus on managing hypertension, especially in the elderly. Hypertension, or high blood pressure, is a condition that affects millions of people worldwide, and it becomes increasingly common as we age. However, managing hypertension in elderly patients presents a unique set of challenges. One of the primary difficulties is the presence of multiple coexisting health conditions, also known as comorbidities. These can include diabetes, chronic kidney disease, and heart failure, among others. The interplay between these conditions and hypertension often complicates treatment decisions, as medications for one condition can potentially exacerbate another. Another challenge is obtaining accurate blood pressure readings in elderly patients. As we age, our blood vessels tend to stiffen, which can cause variations in blood pressure readings, particularly when patients transition from sitting to standing. This phenomenon, known as orthostatic hypotension, can lead to misleading readings if not properly accounted for. Additionally, many elderly patients experience white coat hypertension, where their blood pressure spikes in a clinical setting due to anxiety, further complicating the accurate assessment of their condition. Hypertension primarily affects older adults and is often associated with noticeable symptoms like headaches, dizziness, or shortness of breath. While it's true that hypertension is more prevalent in older populations, It's important to understand that it can develop at any age, often without any obvious symptoms. This is why hypertension is often referred to as the silent killer. Many patients are unaware they have high blood pressure until they undergo routine checks, which underscores the importance of regular monitoring. Effective management of hypertension requires a comprehensive approach that combines medication with lifestyle changes. While medications are often necessary to control blood pressure, relying solely on them without addressing other factors can limit the effect. For instance, diet plays a crucial role in managing hypertension. A diet rich in fruits, vegetables, whole grains, and low in sodium can significantly reduce blood pressure. Regular physical activity is equally important, as it strengthens the heart, making it more efficient at pumping blood, which in turn lowers blood pressure. Additionally, stress management techniques such as mindfulness, meditation, and adequate sleep are essential components of a holistic treatment plan. A case that illustrates these principles in action. Alice, a 72-year-old patient of mine, was diagnosed with hypertension several years ago. Initially, she was prescribed medication, which did help lower her blood pressure, but the results were not as effective as we had hoped. After a thorough review of her lifestyle, we identified several areas for improvement, including her diet, which was high in processed foods, and her lack of regular physical activity. We worked together to develop a personalized plan that included reducing her sodium intake, increasing her consumption of fresh fruits and vegetables, and incorporating daily walks into her routine. Over time, we also added a yoga class to help manage. The combination of these lifestyle modifications with her medication led to a significant improvement in her blood pressure control and overall health. Alice now enjoys a higher quality of life with more energy and fewer concerns about her blood pressure. In conclusion, to enhance hypertension management, especially in elderly patients, we must emphasize the importance of a comprehensive approach. This includes patient education about the critical role of lifestyle changes, regular monitoring, and the need for individualized care plans. By addressing these factors, we can improve long-term outcomes and help our patients lead healthier, more fulfilling lives.
That is the end of Part C. You now have 2 minutes to check your answers.